So if you have heel pain from Sever's disease, you better watch this video because I'm going to show you exactly how you can tape up the heel and the ankle to get you ready to go back on the field, back in the basketball court. First, before we get going, please subscribe to RyleyRehab. I'm coming up with new content regularly, helping you become the expert of your own body. And in this case today, we're talking about Sever's disease. So just for those of you who don't know, it's basically a condition that usually I'm assuming you're around 12, 13, 14. Your heel gets basically inflamed or swollen, or in general irritated, just because your bones grow faster than your muscles. So what you want to do is you kind of want to rest it at first. I'm assuming you're pretty active if you're watching this, but you do want to eventually get back to activity because you got a life to live and you got a bunch of things you want to be able to accomplish. So what you can do when you're ready to go back, so you can get yourself two things. First, you can get yourself some kinesiology tape. I personally prefer K-Tech kinesiology tape, but it's totally up to you. Just find one that sticks. And any general athletic tape you get at a pharmacy. There's two sides you want to do with this. Number one, you want to tape on the back of the leg. And number two, you want to tape around the heel on the bottom. So the first step you want to do is you want to get a strip of kinesiology tape. I would say roughly 8 inches long. It depends on how long your leg is, but let's say 8 inches. Cut the tape here. You rip it on the back and try your best not to touch the sticky part. If it's good quality tape, it shouldn't be a problem if you touch it. And then you're going to start with putting it on the bottom of your heel. So you want to keep it at the kind of back part of the bottom of the heel right there. Pin it on with your hand. And then pull it up. And I would stretch it as much as you can in this case. Think about it, you're returning to sports, so you do want something that does reinforce it good. Pin it on the top while keeping a little bit at the end there. And then get the rest on right there. Basically what you're aiming for is a straight line all the way up the back of the leg. You can use the back of the kinesiology tape to rub it in like this. And that's the first step. Now, once you got the first step taken care of, the next thing you want to do is get around the heel. A lot of the times you can get pain on the bottom of the heel, so you want to actually get all the tissue around there to kind of help cushion it for you. And how you're going to go about that is you're going to take some normal athletic tape, and this is the firmer stuff. The other stuff was kinesiology tape, which is a stretchy tape. You're going to take the athletic tape right here. And what you're going to do is you're going to do a ring around your foot, starting with the outside, right around here, and then going all the way around to the inside of the heel. I'll show you what that means right here. You start with a piece of tape right on the outside, and then you wrap it around the back, onto the inside. You can either rip it or cut it. If you're really good with your hands, you can rip it. And then you place it right there and rub the tape in. The next thing you're going to do is take another strip of tape and go right across your foot in here. So you're basically making a little box for your heel to be inside. One going around here and then one going here. Once you get it rubbed in, I recommend trying standing on this first and seeing how it feels. It should feel like it's taking a lot of the pressure off the heel when you're on it. It should also feel like you're kind of walking on a pillow on your heel. Now, depending on how firm you want that pillow to be is all dependent on your pain. But you want to kind of take a few steps, does it feel too tight? Does it feel like it needs to be tighter? and then you sit back down and adjust. Now usually if you only did one, it's probably going to be too loose and you want to tighten it up. But if it feels just right, then what you can do is you can seal it up by putting a piece of tape on the top, and that's the end of it. I'll show you that at the end of the video. However, if it's too loose, what you can do is just go over the exact same way that you went before. So take another strip of tape and go around the heel like this, and then take another strip of tape and go on the bottom of the heel like that. You're basically doing the exact same pattern. One here, one here, one here, one here. And it really depends. You can also pull it tighter if you would like. However, the real test comes out when you stand on it. You want to make sure that it's still comfortable. It's not feeling like your feet are going numb from this. But in most cases, I would say start with around 3 times through and then see how it goes. You can definitely tweak this though. The big idea with this is you're taking all that tissue of the heel and you're using it to actually pad yourself. So it's like having one of those gel pads in your shoe that kind of takes the edge off. Now I'm standing up again just to check. Let's say here I know I have enough cushion. This is good. The next step you want to do is you want to seal it. So you see these two pieces right here? As soon as I take my sock off, it's going to peel off. So I want to make sure that doesn't happen. So what you want is one strip of tape covering the top part just to stop the thing from coming undone, because as soon as you start sweating, as soon as you start moving, it's going to come undone. You're going to take the piece of tape right here, and really important, you want to put some weight on your foot there. Even if you can stand on your foot, that's better. I'm trying to not cover the camera too much. But stand on the foot, put some weight on there, and then put this piece of tape over top right there. Big reason for that is if you don't stand, you can easily go too tight and then end up cutting off circulation to your foot. The point of this isn't to provide security. The point of this is to stop the wonderful tape job you did on the bottom from coming off. Once you're done, you can mold it all in with your hands. And from that point, you should be good to go. Now, try to jog around on it a little, do a little bit of hopping, do a few things just to make sure that this feels secure enough. For most people, you don't need to have this on all the time, just when you're doing the very sporty stuff, when you're running, jumping, doing stuff like that. However, if it does provide you some relief during the day, you certainly can give it a try. Now, I hope you liked this video. If you like it, please subscribe to RyleyRehab, and I will see you next time.